Hello, everyone. Good afternoon, everybody. I'm Sayukta from Bladder Wellness Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, recurrent stone disease. Stones are hard deposits made of minerals and salts that form inside the body. Diet, excess body weight, some medical conditions, certain supplements, and medications are among the many causes of stones. There are many types of stones like calcium, uric acid, etc. Stones can occur within the kidney itself as well as in the ureter, that's the tube draining urine from the kidney, or in the bladder as well. So, to throw more light on the subject and guide us on what's right for diagnosis and treatment of urinary system stones, today we have with us renowned urologist Dr. Deodatta Chafekar. He is a nephrologist who has been practicing at many reputed hospitals and dialysis centers in and around Nashik. He has many accomplishments to his credit. He has completed his doctorate in medicine in the field of nephrology from esteemed colleges like St. Chias Medical College and Kim Hospital, Mumbai. He has acquired vast experience in this field after having worked with many leading hospitals in Mumbai as well as Nashik. He has been the principal investigator to many clinical trials on dialysis, renal anemia, and chronic renal failure patients. He also has a wide teaching experience in the field of clinical medicine and clinical nephrology and has many publications to his name. Dr. Chafekar has held many significant posts in various medical associations apart from making valuable presentations at several national conferences. And it's such a pleasure to have you with us today, Doctor. A very warm welcome to you.
Hi, good afternoon.
So, doctor, as we all know, kidney stones, renal calculi, it's so common. At least people know about it, and many of us do go through it and do have these kidney stones inside our body in the urinary tract. So, first thing, doctor, what all types of stones are there that form inside our body? How are they formed?
Yeah, so it's a pleasure to be a part of this program and interaction. And I'm sure that at the end of this interaction, the viewers would get some more knowledge about kidney stones in general and how you prevent the occurrence of kidney stones and how do you treat them. So your first question was regarding what are the types of kidney stones and how do they occur. So to answer that, all of us know that there are many crystal forming substances which occur in the body, and these crystal forming substances, they are absorbed from the diet or they are a part of our physiological milieu. So therefore, when these crystal forming substances, they go off balance and either the level of these substances increase in the blood or the level increases in the urine, then what happens is that these crystals, they start conglomerating together, and then you start getting formation of kidney stones, which occur anywhere in the urinary tract. So for example, you can have stones in the kidney, you can have the stones in the ureter or in the urinary bladder or in the urethra. So therefore, basically, many types of crystals are there. So just to name a few, you can have stones which contain calcium as a primary substance, but then the calcium can be tagged with either oxalate or phosphate. So you can have a calcium oxalate type of stone, or secondly, you can have a calcium phosphate type of stone. The other substances which are also important as far as the crystals are concerned are something is called as struvite. Now, struvite are substances which are produced in the body because of recurrent urinary infections. You know that whenever a person suffers from bacterial infection of the urinary tract, and the bacterial infection can be due to various types of organisms. So because of the recurrent infections, then there is conglomeration of some substances which are put together, and that is called as struvite stones. Then the third type of crystal, which is very important in the causation of stone disease, is uric acid. And many times you have high uric acid levels, which can cause uric acid stones. The fourth, the less common one, is called as cysteine. So you have either calcium oxalate or phosphate, you have struvite, you have uric acid, or you have cysteine stones. I must also mention here, I think you also asked about how do these stones occur. So I already told you what are the stones and what are the components of the stones. So stones are basically conglomeration of crystals, and the components I have already told you. Now, whenever there is an imbalance of these substances in the body, either because of overproduction or because of under excretion from the urinary tract. So either the amount of substance in the blood is much more, so that is one cause, or when it is going out in the urine through the kidneys, that substance is much more than normal as far as the volume is concerned. And that is the reason why you get these crystals conglomerating together and you get some stone formation. So it is either overproduction or it is under excretion from the urinary tract. And one last point which I must mention here regarding causation of kidney stones is that there are some substances which are produced normally in the urine, which are stone inhibitors. So some chemicals are produced by the body which inhibit formation of stones or reduce the formation of stones. Now, if somebody has a problem about these substances not being produced in the body, then you start getting more stones. So, for example, one of the examples of such a substance is called as citrate. So, there is some substance called as citrate, which is present in the urine. If the citrate levels go down due to some disease or due to some abnormality, then the incidence of stones might rise. So, in general, these are the reasons why you get the mechanisms by which you get kidney stones.
Right, you have very well explained, doctor, that what are the stones, how are they formed, how they occur in our body. And as I mentioned initially, that we see a lot of people in our society suffering from kidney stone or suffering from recurrence of kidney stone. I would like to understand, doctor, how common are kidney stones, especially in Indian population?
Yes, so to answer that question, I must mention here that we must know which are the patient populations in which kidney stones occur. So one important fact which should be noted is a family history. So sometimes you have stone disease which runs in the family, say from one generation to another, or multiple siblings, brothers and sisters having stone disease. So therefore, if any member of the family has a stone disease, then there should be a corollary that you must be aware that the other family members can also suffer from a stone disease, because rarely it can be genetic and secondly, it can be familial. Then the other illnesses or other problems which are associated with stone disease, which you already mentioned in your opening remark, was obesity. Now, obesity is also related to stone disease. Then we have other causes like recurrent urinary infections, especially in females, and that is one reason why you can get stone disease. Also, there are some medical disorders. So there are some disorders, that means some diseases, which occur in the body, which cause imbalance of all these substances. So for example, you have what is a problem called as hyperuricemia, which means that the uric acid levels in the blood go up. Or you can have a condition called hypercalciuria, means a lot of calcium gets passed in the urine. There are some hereditary disorders where you get cysteine, which passes in the urine. And more important, of course, these are the conditions which are detected by investigations and you have to seek medical guidance. But in general, people should know that if you take a lot of calcium supplements, if you take a lot of vitamin D as pills, then there could be an increased occurrence of stone disease. Similarly, if your diet is not proper, if your diet has a lot of imbalance and you are taking a very, very high protein diet, which is very common in people who are athletes or who visit the gym and do a lot of exercise, they take a lot of protein supplements. Then in those patients, in those people also we find an increased incidence of stone disease. As well as if you are consuming a lot of sugar in your diet, or if you are a pre-diabetic individual, or if you have a family history of diabetes, that is one more reason why you are going to have a lot of stone disease. So one must remember that diet is very important as far as stone occurrence is concerned. Lifestyle is very important as far as stone occurrence is concerned with relation to your body weight, BMI, and obesity. And taking supplements is also very, very important. Besides, of course, the medical illnesses which occur in the body. And I think your question was regarding recurrent stone disease. So yes, a lot of people, they have recurrent stone disease. Now, sometimes the stone disease can occur because of external factors. So whenever we discuss with the patient regarding the stone disease, we also find out what is the geographical location of the patient and what is the quality of water which the patient is consuming. So for example, there are something called as stone belts in India. So a lot of geographical areas are there where a lot of people, they suffer from stone disease. It is said that the reasons why this happens in a particular geographical area is, there are many reasons for that. One of the reasons, of course, could be related to the hardness of water. Now, hardness of water means basically the solutes or substances which are dissolved in the water. If a lot of substances are already dissolved in the water, then the quality of water becomes hard. And then sometimes there is increased incidence of stone disease. Of course, later on, I'll tell you what are the other reasons why you should get stone disease. But I agree that recurrent stone disease is a reality. It is related to poor lifestyle. It could be related to poor diet. There are some inherent metabolic disorders of the body which can also cause recurrent stone disease, but they have to be treated medically. And recurrent stone disease can occur at specific geographic locations.
Right. And doctor, we would also like you to shed some light over the symptoms of kidney stones. I mean, what are the symptoms that we should never ignore and consult a urologist as soon as possible?
So let me tell you first of all that many times we have seen patients who are absolutely asymptomatic, in the sense that a patient has come to me with a routine sonography, ultrasonography test, which is done because he was going for some insurance checkup, and then some tests were done, and suddenly the person finds that he has got renal stones. Now, why does this occur? Because the symptoms depend on the location of the stone and the size of the stone. So many times the location is such that there is space for the stone to expand in the urinary tract, or the size is very small. So in that case, you don't get any symptoms. So one must remember, don't get very surprised if someone tells you that you have a stone disease and then you said that, oh, the report is wrong, or I don't believe the report, for the simple reason that you can get asymptomatic patients with kidney stones. And sometimes, in fact, we have seen horrors where large stones are there, patients do not get any symptoms. But if I have to enumerate the symptoms of kidney stones, then there are many. The most important symptom how stones are detected are by pain. So you start having abdominal pain, which is called as loin to groin pain. So it starts from the loin. Loin area is the area where on the back of our abdomen, on either side of the spine, you have the kidneys. So the pain starts there, and then it goes down towards the groin. So that is the type of pain which occurs in patients who have kidney stones. Also remember that this type of pain is a colicky pain. Colicky means it occurs intermittently, but whenever it occurs, it is very, very severe. And the patients have a lot of pain, and in fact, they can have accompanying vomiting, they can have a lot of sweating, and a lot of patients, they suffer a lot because of severe pain. In addition to this, you can have urinary symptoms. So what are the urinary symptoms if a patient has stone disease? Obviously, because of the movement of stone, you can have red urine. So passing of blood in the urine can be a symptom of stone disease, especially if the stones are mobile. Then you can have burning in urine. The third symptom related to the urination is frequency of urination. That means you go and pass urine multiple times, either during the day or during the night. And this also will be accompanied with a lot of nausea, as well as rarely, if there is an accompanying urinary infection, then you also can have fever along with a lot of chills and rigors. So all these are the symptoms by which you can suspect kidney stone disease or stones anywhere in the urinary tract. And as I already mentioned, one should not forget that somebody can be totally asymptomatic.
Right. And as you also mentioned, that severe pain is one of the major symptoms, unless it is asymptomatic. But then we also know, doctor, that in case of appendix, we also get severe pain. So how to differentiate between pain due to kidney stone and appendix?
Yeah, so appendicitis is a condition, again, which is very, very common, and a lot of people suffer from it. But remember that appendicitis is related to our gastrointestinal tract. That means our intestines or the digestive system. And when we talk of kidney stones, it is related to the urinary tract. Now, how do you differentiate between the two? The appendix lies in the front of the tummy, on right side of the umbilicus, and that is the area where you get pain due to appendicitis. But as I already mentioned, pain due to kidney stones or stones in the ureter, it occurs in the loin. The loin is an area where it is behind the abdomen. It is not in front of the abdomen, and it is on either side of the spine. And the appendix pain will be localized and it will be at that place only. While the pain which is related to kidney stones will be moving from loin, which is at the back, to the front side of the abdomen, front side of the tummy. So that is how, again, you can differentiate between the pain related to appendix and pain related to the kidney stones. I must also tell you that we have only one appendix, which is there only on the right side. So you can get kidney stones on the left side also. So if you get kidney stones on the left side, and if you are having pain, then naturally you are not going to suspect appendicitis, because appendix is on the right side.
Right. But the bottom line is that in case you have severe pain or any of the symptoms that the doctor have just mentioned, please go and consult a doctor. Please go and consult a urologist as soon as possible. Do not ignore or do not self-medicate. Go and take the right advice from a doctor. Now, doctor, we would like you to shed some more light about the treatment options. You know, what all treatment options are available? Because earlier, I could recall that only surgery was there, or people used to do a lot of, hit and trial, a lot of home remedies. Again, the question is that how effective are these, or are we just wasting our time with those home remedies, or we should go and consult a doctor? Is it that important? And of course, with the medical advancements, etc., how easy is the treatment now?
Yeah, so when we talk of treatment, I think one must remember that the treatment would depend on many factors. So, for example, you sometimes you need urgent treatment if the pain is very, very severe, and you really had to go and see a doctor, and then he will examine you and try and find out what is the location of the stone. And can I tell you, before we talk of the treatment, can I tell you a bit about the investigations of what type of test which we do?
Definitely. Yes,
So,
doctor,
so
definitely.
before we talk of treatment, I think I'll just mention here what kind of tests are done to diagnose kidney stones. So, generally speaking, we do two types of tests. One is to localize the site of stone. Where is it located in the urinary system? So as I already mentioned, it can be located in the kidneys or in the ureter or in the urinary bladder or in the urethra. Now, the easiest test, of course, is an ultrasound examination or ultrasonography, which is a very easy thing to do. Of course, you can also do an X-ray, and the X-ray is also going to tell you if there is a stone there. And we know that there are some radio-opaque stones or radiolucent stones. Some stones are not seen on X-ray, some stones are seen on X-ray. But usually the sonography picks up almost all the stones. Now, once you have said that there is a stone, then we would like to know what is the component of the stone. And I already mentioned that there are many types of crystals which conglomerate together to form stones. So the components can be many. So then we do tests to find out what can be the predominant component of the stone. So for example, we look at the calcium levels, we look at the phosphorus levels, we look at the uric acid levels, both in the blood and in the urine. And we, depending on our clinical suspicion, we can ask for some more tests also to find out what is the type of stone. So one is the location of the stone. And for location of the stone, the other tests which we do are, we can do a CT scan of the abdomen, or we can do a test called intravenous urography. Again, these are tests done by the radiologist, and there again you can localize the stone. And to find out the type of stone, I already mentioned that we are doing the test in the blood and the urine to find out what exactly is the type of crystal which is getting crystallized and forming stone. And the last point, as far as the diagnosis of type of stone is concerned, is we do what is called a stone analysis. Now, if somebody passes a stone in the urine, or if somebody gets operated and stones are removed, then it is always worthwhile to get that stone examined in the laboratory. So if you have a patient who is suffering from stone disease and somebody has passed the stone in the urine and he is able to pick up that stone, then it is worthwhile asking the doctor whether he would like to get that stone analyzed in the laboratory. So there are some tests which can be done on the stone itself, which is removed or which is passed out. And once you do the stone analysis, then you will get a fair idea of what are the components of that stone. And based on that, even the treatment can change. So for example, the components can be related to calcium, it can be related to uric acid or oxalate or cysteine, etc., etc. And then the treatment will change depending on what are the exact components of the stone. So don't forget to ask your doctor whether he wants to get the stone tested. And now coming to the treatment part.
Treatment options. Yes.
Yeah. So the treatment options should be considered based on two facts. One is what is the location of the stone and what is the size of the stone. So this is part one. And part two is whether the stone is recurrent or no. That is the second part. So now let me discuss the second part first. Now, if the person has got recurrent stone disease, then what happens is that it is mandatory to find out why the person is getting recurrent stone disease. So, of course, I mentioned that it could be a familial or a genetic cause. But beyond that, there are other causes also. So therefore, if you are having recurrent stone disease, please ask your doctor whether he wants to do some tests to find out why am I getting a recurrent stone disease. And I already mentioned some tests to you which can be done to find out the type of stone disease. If you find that the stone disease is recurrent, then first I will talk about the conservative treatment. What is conservative? That means without any surgical intervention. In our language, it is called as conservative treatment. So it can be based on diet and it can be based on some medications. So what kind of treatment we give, which is non-surgical, especially in patients with recurrent stone disease. So in those patients, the first important thing is what is the fluid intake? How much water should I consume to prevent recurrent stone disease? This is a very common question which is asked by the patients to the doctor. Now, our answer is that amount of water which you should consume should be the amount of urine which you pass should be at least 1.5 to 2 liters. So the amount of water which you should consume to pass 1.5 to 2 liters of urine depends on your environment where you are. So for example, if you are sitting in an air-conditioned room all the time, then you don't need to consume a lot of extra water to produce 1.5 to 2 liters of urine. So then you can get away by drinking about 2.5 to 3 liters of urine, and then your target is achieved. But if you are in a hot, humid climate, then obviously you are going to have a lot of insensible water loss, and that is, or sweating, and that is the reason why then your water intake should be much more than 3 to 4 liters. And that is how you are going to produce 1.5 to 2 liters of urine. And that is the recommended water intake. So the water intake will differ according to your environment and according to your working conditions. So this is the first part. Second part, I already mentioned about the hardness of water. So you can get your water tested, the one which you are consuming, and find out what is the hardness, and take the necessary precautions to reduce the hardness of water so that the solutes which you consume through that drinking water are much less. And that is how you can again prevent stone disease. Once this water thing is taken care of, then of course, the second most important thing is the diet. Now, what are the dietary precautions which we must follow for all patients with stone disease? Again, this is a very important question which is asked by all the people. Now, remember that two dictums are there, two thumb rules are there as far as diet is concerned. One is restriction of salt. So please remember that salt is sodium chloride, our normal table salt. So you must reduce salt in the diet. How much to reduce? The normal salt intake in an Indian diet in 24 hours is about 8 to 12 grams per day. Now, how much you should reduce? You should be consuming 1/3 of that. So the amount of salt which is allowed to you in a patient with recurrent stone disease is not more than 3 to 4 grams per day. So you have to be really going low on salt. Second and most important thing which one must remember as far as diet is concerned is protein intake. So I already mentioned about protein supplements which are taken by all the people who visit the gym. So high protein intake, again, it will contribute to recurrent stone disease or formation of stones. So please remember that don't take a very high protein diet, because that is going to add up to your cause of stone disease. And the third thing which I already mentioned is a lot of sugar in your diet. So any sugar in your diet or history of diabetes with high sugars, again, beware that this can increase the incidence of stone disease. Then you have other dietary precautions depending on what is these are general precautions which I mentioned. So general precautions are salt, proteins, and sugar. Everything should be low or moderation. But these are for all types of stone disease. So whether you are having calcium, uric acid, or any type of stone, these precautions are mandatory and universal. But there could be some more extra precautions as far as diet is concerned, depending on the type of stone which you have. So for example, if you are having a uric acid stone, then you have other dietary precautions which are extra. There are some food items which are high in uric acid, so therefore we advise don't take those food items. If you have an oxalate stone, again, there are some food items which are avoided. So therefore, your advice regarding diet will change according to the type of stone also, besides the general advice which has already been given. So as far as treatment is concerned, these are the basic things which every patient of kidney stone must follow. So amount of water to be taken and the diet to be followed. Now, besides this, if a person is symptomatic because of kidney stones, then what do? We give some medications, one, to produce lot of urine, so that because of the increase in the urine flow, there is a higher chance that the stone will flush out. For that, of course, you need to drink a lot of water, or sometimes we give intravenous fluids, or we give saline, and then we try to flush out the stone. So that is in our language called as hydrotherapy. Now, besides that, we use some medications to reduce the pain. We also use some medications which open up the urinary tract so that the stone passes out very, very easily. So these medications are used by doctors, and they not only relieve the pain, but they help the stone to be pushed out without any surgical intervention or without any operation. So this is the first part as far as how do you treat the patients with kidney stones, or how do you treat patients who have recurrent kidney stones. Now, what is part two? Now, part two depends on what is the location of the stone and what is the size of the stone. If the size of the stone is, say, small, which is about less than, say, 6 millimeters in size, anywhere in the urinary tract, then generally what we feel is that the chance of that stone coming out without any operation is good. So if the stone is small, then we try and use all the medical line of treatment which I already mentioned, and that is how we treat the stones. But if the stone is big, when I say big, I mean more than 8 to 10 millimeters or 1 centimeter in size, and also where is it located? So sometimes it is located in a very narrow part of the system, of the urinary system. So if it is located there, then as soon as it starts moving, you are going to get a lot of pain. So that is the time when you might need a surgical intervention, because the stone will not pass out because the size is big. So depending on the size and depending on the location, then we decide whether the patient requires a surgical intervention or an operation. And to answer the next part, before you ask, what are the types of interventions or surgical operations which we advise? So generally, what we advise is there are 3 types of surgical treatments which we can think of. So one is called as ESWL. So what is ESWL? It is called as extracorporeal shock wave lithotripsy. So there what is done is you just pass a tube inside the urinary system and keep it there for some time, and you don't cut anything else. What you do is you give sound waves from outside, like an ultrasound, with an ultrasound machine, and these sound waves, they go and give shocks to the kidney and shocks to the stone. Now that stone, it will break up into various small particles, and then that stone will be passed out in the urinary system. So that is called as extracorporeal shockwave lithotripsy, which is done without a major surgery. And this is also done in specific types of stones. The second type of operation or surgical intervention is done by using endoscopy. Now, endoscopy, you know what is endoscopy? Endoscopy is passing tubes inside the urinary tract where you don't cut open anything, but you pass a tube and remove the stone. And when we are talking of endoscopy, we are also using some extra gadgets which give laser therapy. So you can use lasers to break the stones after doing endoscopy, and then the stone is made into a powder, or pulverized, and that stone comes out when you are giving a wash after the surgery. So this is the second method when you use endoscopy, or along with that, laser treatment to break the stone. And the third treatment is, of course, open operation, where you actually cut open the abdomen, cut open the kidney, remove the stone under vision, and then you suture it back. Of course, nowadays, majority of the stones are removed by the first or the second method, and only about 5 to 10% of patients, they require open surgery, where the stones could be very big, very difficult to approach, etc., etc. So in general, in a nutshell, what I have tried to tell you is what is the non-surgical treatment for kidney stones, and what is the surgical, what are the types of surgical treatments for kidney stones. I'm sorry that my answer was very, very long, but I tried to cover everything.
Actually, so you have covered it all, doctor. But one thing, because you have mentioned laser treatment, and people are normally very skeptical. They would like to know that is laser treatment effective and safe in removal of kidney stones?
Yes, so laser treatment is done, of course, in selected group of patients where it is likely to be successful. And as I already mentioned, it is done with the help of endoscopy. So therefore, the selection of the patient is very, very important. Every patient does not respond to every type of treatment. So depending on the type of stone, the hardness of the stone, the location of the stone, the duration of stone, there are so many factors which have to be taken into consideration to decide which patient will respond to which type of therapy. But one need not get worked up about either of the therapies, whether it is lithotripsy, whether it is laser treatment, or whether it is open surgery. Ultimately, you have to get rid of the stone by any of the methods, and sometimes we in fact combine two methods to remove the stone. So that also can be done.
Right. And before we wind up, before we sum up the whole session, doctor, any take-home message or anything that we have missed out on and you would like to focus on that as well?
So I think a few take-home messages at the end of this interaction, which should be practical, I think. One is that you must consume proper amount of water, even if you don't have a stone disease, for the simple reason that you could be having a stone disease at any point of time. So the water intake should be adequate, number one. Number two, you should take care of your body weight. You should not be considered an obese person, or take care of your BMI. That's number two. Number three, proper lifestyle is very important. Stones are more common in patients who have lifestyle diseases. So pre-diabetes, diabetes, people with hypertension because they have a high uric acid, and then there are some other genetic disorders. All these are situations where one should take care of your lifestyle diseases, try to control your blood pressure, diabetes, and other problems properly, and then probably you are not going to get recurrent stone disease. The fourth take-home point should be related to the diet. I already mentioned regarding low salt, low protein, low sugar diet. So basically, it should be a balanced diet, which will not cause you any health problems. That should be the message as far as the diet is concerned. And if you are having a recurrent stone disease, then of course, it should be a specific tailor-made diet with the help of a nutritionist or a dietitian, so that you don't, you pay a lot of attention to that factors, and then you get rid of the stones. And the last point which I want to make is that do not ignore recurrent stone disease. A lot of people ignore that, and ultimately they land up with damage to the kidneys. And once the kidneys are damaged because of recurrent stone disease, then it is very difficult to go back and get those kidneys online again. So therefore, please do not ignore the stones if you know that you are having kidney stone disease, and try and take the proper treatment with proper investigations which are done on time, and do not get scared about any surgical treatment, because ultimately if the stones are not removed, then they are going to damage the kidneys on a long-term basis. So therefore, talk to your doctor regarding what is the proper treatment, surgical treatment, which you deserve, and then please go ahead with that treatment well on time so that you save your kidneys from further complications.
Right. Thank you so very much, Dr. Deodatta Chafekar. It was wonderful talking to you. Thank you for your valuable time, and it was a very informative session. Thank you for that.
I enjoyed that too, and I hope that whoever attended this session, their time was well spent.
Yes, doctor, and we really look forward for many more such sessions in coming times with you.
Thank you.
Thank you, doctor. And viewers, thank you for your active participation. For more information and updates, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day. Goodbye.